What is nerve stimulation for bladder problems? Nerve stimulation for bladder problems is a medical treatment that uses electrical impulses to help manage bladder function. This approach is particularly useful for individuals experiencing symptoms like urinary urgency, frequency, incontinence, or retention. It is often considered when standard treatments, such as medications or behavioral therapies, do not provide sufficient relief or are not well tolerated. There are two main types of nerve stimulation used for bladder issues. The first is called percutaneous tibial nerve stimulation. This is a minimally invasive procedure. A thin needle electrode is inserted near the ankle to stimulate the tibial nerve. This nerve shares spinal roots with the nerves that control the bladder. By sending electrical impulses from the tibial nerve to the spinal cord, this treatment can help reduce bladder overactivity and improve control. Patients typically undergo about 12 weekly sessions, with each session lasting around 30 minutes. After the initial treatment, maintenance sessions may be needed. Studies show that about 50 to 80% of patients experience significant symptom relief, including reduced urinary frequency and urgency. The procedure is generally safe, with mild sensations like tingling or pulsing felt in the foot during stimulation. Most patients report no major side effects. This treatment is effective for overactive bladder symptoms, including those caused by conditions like multiple sclerosis. The second type is sacral neuromodulation. This is a more invasive procedure where a small device is implanted under the skin in the lower back. This device sends mild electrical impulses to the sacral nerves, which are located near the tailbone and help regulate bladder and pelvic floor muscles. Sacral neuromodulation can improve bladder storage and emptying functions. Approximately 70 to 85% of patients find relief from urinary incontinence and other bladder symptoms after this treatment. The implanted device can be controlled externally via Bluetooth, and it may trigger metal detectors similar to pacemakers. Importantly, sacral neuromodulation does not affect other bodily functions beyond bladder and bowel control. This option is usually recommended for patients who have not found relief from less invasive treatments. From the perspective of bladder health and bladder cancer management, nerve stimulation therapies can significantly enhance quality of life. They are particularly beneficial for those with overactive bladder symptoms or neurogenic bladder dysfunction. While these therapies do not treat bladder cancer directly, they can help manage bladder symptoms that may arise from cancer or its treatments. It is crucial to remember that nerve stimulation treatments should be prescribed and managed by healthcare professionals specializing in urology or urogynecology. Each patient's individual needs, potential benefits, and risks must be carefully evaluated. These therapies are backed by current scientific consensus and clinical guidelines as effective and safe options for certain bladder disorders. Always consult with a healthcare provider to determine the best treatment approach for your specific bladder health needs.